Welcome to A Journey to Whole Woman Health, the podcast where science, mental health, and faith come together to educate, empower, and encourage women in every season of life. We are your hosts, Dr. Jamie Erwin, board-certified OBGYN,
and Dr. Mary Catherine Nader, licensed professional counselor with a PhD in counselor education and supervision. Jamie and I have been friends for over 30 years.
Each week, we explore the intersection of body, mind, and soul, bringing you evidence-based medicine, meaningful conversations about mental health, and stories that remind us we're not alone on the journey.
So take a deep breath, settle in, and let's begin the journey.
Welcome back to A Journey to Whole Woman Health. This is part 2 of Julie's story. We are talking about infertility, pregnancy loss, and hope. And we left you with a cliffhanger. Julie Davila is with us, and we're so glad you're here. We are learning a lot. I know we are meeting the needs of so many of our listeners who may have a similar journey. Infertility is common. Pregnancy loss, we believe 20 to 25% of all pregnancies end in early loss, the most common reason being a chromosomal abnormality, what is known as aneuploidy, which is a change in the chromosomes of that embryo. And Julie has been brave to be vulnerable, to open up her heart, to really share her story over many, many years and what she's learned and what she wants to pass on to women experiencing similar things, and to friends and even doctors, caretakers, those in healthcare, and how we can do better. So let's pick up where we left off. Julie, you shared with us 2 miscarriages that you experienced, 2 dilation and curettages, which is a surgery performed by an OBGYN to treat a miscarriage. So pick up from there, my love. What was next?
So that was 2023, and 2024 was just regular old life, smooth sailing, and
still feeling good. Endometriosis was
still felt fine,
in check.
Yeah, I'd gotten in better physical shape. Just continuing to take care of my body like I had in the past. I think I just got a little bit more focused and concentrated on that, just with age. And then in 2025, in March of 2025, I got another positive test. And I woke up that morning and I realized I was late on my cycle, but it had felt different. And so I was laying in bed and I Googled perimenopause symptoms because at the time I was 41 and thought, okay, this is probably coming next. And I read what Google told me were perimenopause symptoms, and I didn't feel any of those things that I was reading.
What did you read?
Just mood swings and the sweating and I think appetite changes. And I mean, I was still laying in bed, but I hadn't had coffee yet, but I just thought that doesn't sound like what I'm feeling right now. And the only other thing I thought to do was to take a pregnancy test because I had them in the bathroom, and that could just rule that out because I had kind of ruled out perimenopause symptoms on my own, not a doctor, and diagnosed myself with not that.
Yeah. And for our listeners, go back to episode 5 and you will learn all about perimenopause.
Yep, exactly. And so I took a test and got ready to go work out in the morning and went back, and the test said I was pregnant. And it had been over a year since I'd seen a positive test. And I took it out to show my husband, and he looked at me and he said, "What is that?" I said, "We're pregnant." And immediately we only have loss to go off of. And so that's where we both went immediately was, well, we just kind of assume we're going to lose this one again because that's all we had known. And I guess that's just human nature. That
was there a sense of dread, or what was the feeling?
A little bit, but it had been over a year with no positive test. And so it was like, I mean, okay, we've done this before. Let's figure out what's next. So I think it was more scared than dread, because we didn't think it would happen again at all. And because of our past, that's all we knew.
Right.
And so that's where we went.
Sure.
And I think I reached out to Jamie and said, I got a positive test. And I went in and had labs that day. It was a Wednesday. And then I went again Friday and had labs, and everything was looking fine. But they had previously too. Right. The numbers were going up. And
so this was a year ago, March 2025. Okay.
Yes.
And those labs we're looking at the beta HCG level, which is the pregnancy hormone level. And in most viable pregnancies, we will see that beta HCG number increase over 48 hours. We would like to see, at least a 37% increase or more to give us that reassurance. But like you said, the numbers aren't everything, and it's really more of a prediction, like how do we think this pregnancy is going to go? What's the natural course? Not that we can intervene and change the outcome, but just for expectations.
Mm-hmm. So that's what we did, and we kept on, and we went out of town for spring break and came back and had an appointment, and we had been into the sonographer's room and in our previous pregnancies, and kind of had a hunch that maybe this wasn't going to work out on those two. And we went in, and it was still too early, that first one, to see any kind of heartbeat. And so we waited and went back the next time, and she was doing her scan, and she said, and look, right there is the heartbeat. And we both are in the room, and we looked at each other, and we're like, wait, what? And I said, I apologized to the tech. I said, I'm sorry. Can you go back to that? We have not heard a heartbeat in our pregnancies in the past.
That gives me goosebumps.
And so it was like, oh my gosh, we got even a little bit further. We got to a heartbeat. And she, of course, went back, and so we got to hear it and see it on the screen. And all of a sudden, it was like, okay, this really feels like a life now that this baby has a beating heart. And we were once again in uncharted territory, seeing it and hearing it. And we had things working against us, like my age, which I tell people, like, that's one of those things we can't change. We can't go back. And so that's what made me the most nervous, was my age, because I was 41 when we got that test back. And I just thought, there's a reason that we are here, and we see this heartbeat, and that I'm 41, and all those things that I couldn't control. I just had to give it up to the Lord. And I remember going into my appointments with Jamie and walking in, waiting for the bad news, because that's what I was used to.
Mm-hmm.
Just, there's something wrong with the baby. There's something wrong with me. There's, your brain goes to crazy places. And every time we went in, for the first 20 plus weeks, it was just fine. Everything was fine. And Jamie said, you've got to stop thinking about the bad that could happen. Like, let it go. We cannot control it. And I would tell myself that walking in, like, it is what it is. Like, we've done what we need to do. Like, hold on to the hope that everything's fine. And then I would walk in, do the exam, and everything was fine. It was like, wait, what? It was so hard for me and my husband to believe that we were where we were, given our history. And it was great, but it was so nerve-wracking. again, because of our history. And the labs all looked fine. The baby looked fine. There was a great heartbeat. There was one tiny setback in September that we saw a specialist for, and that worked itself out. And so again, it was just, I mean, I'm not a doctor, but textbook, everything was fine.
I agree with that statement. And Mary Catherine, speak to us about what Julie's describing. I know Brene Brown, we talk about her a lot, but she talks about armoring up, bracing for the bad.
Yeah.
And as a result, we can miss out on the joy of the now. What do you have to say about that?
Yeah. I mean, I think it just, what you've experienced, Julie, I mean, that's what made sense to you. And I mean, thinking about it was traumatic, you know, it's trauma. You're walking into this place where you've had very traumatic things happen, and that's telling your body, prepare, be ready, put on the armor, something bad's about to happen. Because you're having all those triggers. I mean, even just the physical reminders of this is the position I was in, this is what I was doing, this is how the sonogram felt, you know? So for sure, I mean, that is exactly, that's normal, because that's all you, like you said, that's all you'd experienced before. So it made perfect sense that you would be feeling that way.
Just coming into my office.
Yes.
Can be triggering.
Yeah, it can.
For some patients.
Yes.
And I know, I think there's even some patients who have found another provider that may had nothing to do with me, maybe it did, but they just couldn't come into the space. And
yeah,
I get that. Like,
sure,
that's okay.
Yeah.
You know, sometimes you need a fresh start with a new environment because it's just too triggering.
Yeah.
So how brave of you that you continue to show up.
Yeah. And even as the news continued to stay the same, it was like, I had to tell myself, like, you have nothing to worry about. Now, saying it is different than believing it, but it just felt so foreign to be where we were week after week, counting the weeks. And, you know, we'd reach a hurdle and we'd be fine. And then we'd reach the next hurdle, the genetic testing. We held our breath because of my age, and the genetic testing came back perfectly fine. And so it was just, okay, let's go again. Let's go. Let's keep trucking. And that's what we did. I was hesitant to say yes to anybody planning a baby shower for me because that just felt like a stake in the ground that I maybe wasn't going to make it to. And I had stopped going to baby showers for years and years because it was too hard. And my friends and family understood. But now it was my turn to have a baby shower. And I thought, well, I mean, I've done this for lots of other people and now they want to do it for me. But what if something bad happens? Like my heart and my brain would go there. And I finally said yes and had the baby showers, and it was great. So.
And how many times did the three of us just kind of sit in that exam room at your appointments and just kind of look at each other?
Yeah.
And cry and laugh and just, we shared the awe.
Yeah. Because we were genuinely in awe of everything happening, and that there wasn't bad. There wasn't, that shoe wasn't going to drop like we thought, or like I thought. And so, yeah, it was great. It was a great feeling and a great journey to walk through. That prior to March of 2025, I just didn't think it was going to happen. So,
yeah.
Amazing. Amazing. So, the time came.
Yeah.
We needed to meet this baby.
Yeah. We made it to 39 weeks and went in to be induced. And, I had the medicine and pushed for almost an hour. And her heartbeat dropped and heart rate dropped. And I remember Jamie saying, "We have waited way too long for this baby. We're not playing around." And I was like, yes, let's go. And so we didn't play around anymore, and we went, and I had a C-section. And the plan all along was just get everybody out on the other side.
Safe mom, safe baby.
Yeah, I trusted Jamie. I trusted everybody in there, and it was great. I don't remember a ton of it, but a dear friend of ours was there as our nurse, which there were so many people involved, and like these little God winks throughout the whole few days we were there. One of the nurses took pictures with my husband's camera because she's a photographer on the side, and
Andrew's a photographer. He's not just a photographer. He like teaches it, lives it, does it. Like it's a big time. So
those were important photos to get.
Yeah. Y'all show up to have the baby, and he's got like 3 cameras, right?
Yes.
Tell us that story. We go back to the operating room.
Yeah, he's all scrubbed in, ready to go, and he's got a camera, and he realizes he forgot a camera in the room. And this person that we didn't know prior said, "What are you looking for? Tell me what it is. I'll go get it." And so he describes this camera, and this person goes back and grabs it from our room and brings it. And
it was the anesthesiologist.
I love that. That's awesome.
Yeah. And, you know, in the moment, there's so much happening that he wanted to be present with me and watch and just all of it. And so we have these cameras sitting there, and one of the nurses that's a photographer on the side picks up the camera, knows how to use it, and starts capturing these great photos that are priceless because, like I said, I don't remember a ton of what happened, but I have these great photos, and they're not just like blurry phone photos. They're from a camera, and they're great. So yeah, she was here, healthy. She, 7 pounds, and yeah, it was a redeeming event, I think. As hard as it was physically, it felt like my body had what I thought had failed me for 42 years at the time, had finally not failed me. I did it. She was here. We were both on the other side and healthy. And this prayer and dream that we thought had gone away, suddenly our whole life has changed.
Wow.
Yeah. And she's gorgeous.
She's great. She's wonderful.
Yeah. My most favorite patient gift ever. Yes. I meant to bring it with me. Julie had these amazing car fresheners made that you hang on your rearview mirror with her sweet baby's face.
Aww.
And the sweetest note that she sent to me, and have a little bit of her with me all the time.
I love that. That's such a great idea.
Yeah. We gave it to family at Christmas and some special friends like Jamie. And I have a friend who I gave one, and she doesn't have children of her own. And so she has this face of a baby hanging from her mirror. And she went a couple weeks ago to Discount Tire and dropped her car off. And the man at Discount Tire said, "Is that your baby?" And she said, "No, that's a baby that was really, really special and was prayed for so many years. And we got to meet this baby last year."
Mm-hmm.
So this friend is telling this complete stranger at Discount Tire about my daughter.
Yeah.
And the miracle that she is from an air freshener with her face on it. Which I didn't think about that being a possibility when I ordered them at Christmas. But, I mean, this man now knows about my daughter and the miracle and the prayers that were prayed to get her here. Yeah. And so that's just fun stories to hear.
It's inspiration. Yeah. What do people need to know about interacting with a woman who may be having a similar journey that you are? Like, what are the takeaways? Tell us about instances that didn't go well, whether it's friends, family, well-meaning people doctors.
Sure. Nobody knows what to say or how to help or how to interact. So,
Yeah.
Tell us how to do better.
yeah.
I think from the get-go, we, as not just women, but as humans, don't need to assume anything about anyone. We don't know what people are going through. We don't know what battles they're facing. And so whatever that thing is in your life, you may share it with someone, but you may not. And someone may say something that might offend you or hurt your feelings. And so we just need to go into conversations and interactions, I think, with love and grace to begin with, because we just don't know what people are going through and what they're facing. From the outside, nobody would have known I was going through infertility or getting shots in my stomach for fertility treatments. And sometimes baby shower invitations would be triggering to me, but I have learned that for me, I wanted to be invited, I wanted to be included, and then I wanted to be the one to make the decision on whether to participate or not, rather than not being invited and then being excluded. And so I think that's something I've learned now on the other side. I don't want to make someone's decision for them. And if I need to send them a text ahead of time, like, hey, I'm going to send you this, or I want you to know this before everybody else knows it, or whatever, I think that's the kindness that we can share with others. And just having been on both sides now, I have such compassion for women going through infertility and how hard it is and how different it is. My journey is not going to be the same as somebody else's. And that's okay. And what hurt my feelings or offended me might not for them. I think we should also go in and not assume that people want to have kids or already have kids based on their age. Because we can all make those decisions for ourselves. And as women, I think we're brought up to believe and think that we're supposed to be moms, that we're supposed to bear children or have children. And some people choose not to, and some people want to and can't. And so knowing that can help protect our own tongues from saying something that shouldn't be said and hurting someone's feelings. I did want to be a mom, and so somebody asking about that did still hurt my feelings when I wasn't a mom and I couldn't become a mom like I thought I could. And so I think just being sensitive and not really asking those kinds of questions that could trigger somebody starting to cry or having an awkward conversation or offending someone. I think that's the best way to start, is just don't bring it up. If they want to talk about it, then let them talk about it. But also, if you know that person's going through something because they've shared it with you, then I think it's appropriate to ask, can we talk about this? Or do you want me to ask you about this? Mm-hmm. Because if nobody talks about it, nobody asks, that's the complete opposite end of, do they even care? Do they even remember? Do they even want to know? And so it's a slippery slope, I know, but and it's going to be tailored to each person. But that's what I would say about what to do and not do.
Yeah. You started a ministry at your local church.
Yes.
Tell us about that.
So a friend and I, it was already a national ministry called Waiting in Hope. And we wanted to bring a chapter of it to Fort Worth because there was nothing in our local church that was ministering to women and young couples going through infertility and miscarriage. It felt like a giant gap in outreach at our church. You go to college and then you get married and then you have kids and then, all those things. Well, if one of those things doesn't happen, there's not a place for you in the church. And both my friend and I felt that way. And so we took a lot of convincing and meetings and time, but we got the church to say yes, they'd be on board. And so we started a group of Waiting in Hope here in Fort Worth, and it was for anybody in Fort Worth, not just people at that church, to attend. And so we wanted a place for women to come share and cry and pray, and a place where we could kind of speak the same language, because we were walking through similar things, not the same, but also have a spiritual conversation about it, and hope, because we're not promised children, and at the end we still want to be walking with Jesus and have a relationship with Jesus, whether there's a child or not. And so that was the goal and the aim of the ministry. And we had women drive in from North Richland Hills and Weatherford because there were women hurting all over our city that didn't have a place to go and be vulnerable and have a safe place to talk and share. And so we provided that and had support from our church, and we did it for many years and had many women come in and out of the doors. Some have kids and some don't have kids. And it ministered to me, even though I helped lead it, because I got to share my own stories. And we did Bible studies and read scripture and prayed for one another and got lunch one-on-one. It was just a really sweet community of women that was formed out of this gap and need in the Christian community that we had seen nobody else was really filling.
Yeah, I agree. I still think the gap exists in the church, big C, capital C, church. And, maybe this will encourage women who are listening to start that up locally, start a tribe, start a community, whether it's faith-based or not. Yeah. We need each other, and we can't go through these journeys in isolation. We're stronger together to support each other.
Mm-hmm. Yeah, and I love what you said about, everybody's journey is different, and there's really no comparison. We're not in a competition here, The stage of life one of us is in is going to be different than somebody else's, and one person's pregnancy journey is different than someone else's. I love that. Yeah. Thank you for sharing that.
Yeah. And sometimes the happy ending may not be a baby at the end.
Right.
That is your story. And we're so thankful for that and this beautiful life that is now a part of your world. But I love how you made that clear, that we're not in charge of that ending. Mm-hmm. And ultimately, we have the opportunity to grow emotionally, spiritually, mentally. Yeah. Into stronger women, regardless of the outcome.
Yeah. And I think my journey presented things like this ministry that maybe wouldn't have started had I not walked those years of infertility. And there may be women in Fort Worth that wouldn't have had a place had I not walked through infertility. And so there are good things that have come from it and continue to come from it. And to just find your people to be with, that lift you up, because there will be times when it feels like there isn't anyone. Yep.
Yeah, I love it. Any parting words, Julie?
I don't think so. Just, find your people and cling to Jesus. And
there's hope.
There's hope.
There's always hope. Such a powerful message. We cannot thank you enough for being so vulnerable and sharing your heart. Mm-hmm. And it's blessed us. I know it's going to bless our listeners.
Thank you.
Thanks for joining us today. Please share this with a friend who you know will find impactful.
In this episode, we'd like to highlight Legacy Place Retreat. Legacy Place Retreat creates a space for your marriage to breathe again. It exists to encourage couples facing infertility, childlessness, and loss, to equip them with the resources they need to build strong, healthy marriages and empower them to shape a legacy that reaches beyond their circumstances. Visit them at legacyplaceretreat.com. Thank you for joining us on a journey to whole woman health. If this episode encouraged you, share it with a friend, leave a review, or subscribe so you don't miss future conversations. Remember, your questions matter. Your health matters, and wholeness is a journey. Until next time.
Now for the legal language. The information shared in this podcast is for educational purposes only and is not intended as medical or mental health advice. Listening to this podcast does not establish a doctor-patient or therapist-client relationship. Always consult your own qualified healthcare provider regarding any medical concerns.